Christian Lindmeier, who is the spokesman for the World Health Organization. He joins us now from Geneva. Christian, good to have you on the show. A very grim milestone that we've reached over the weekend. 10 million positive cases for COVID-19, 500,000, 500,000 people have died as a result of this. The Director General of your organization had a press conference yesterday. He said, "I'm sorry to say that, but with this kind of environment and condition, we fear the worst." This is 6 months into this pandemic. If it's not going anywhere anytime soon, what is the worst case scenario for your organization, let's say, in 6 months' time?
It would be very difficult to give a prediction, even more difficult to give a grim prediction. But the important part here is that countries need to do all they can, and people need to do all they can. And that starts with the simple hand hygiene and mouth hygiene, which was just also talked about in the previous report, but also in the testing and tracing of every single case and every single contact. If you do this, you follow up, you find your cases, and you get a good picture of where in your country the virus is. If you know that, you can respond to that. You can shut down an individual school, for example, if there's an outbreak, or you can control an outbreak in a village, in a town, whatever. Much easier than if you don't have this information and you only see a spike in hospitals, because then you need to take drastic measures because you don't have a picture of what's going on. And this effort, this will determine the near future until we have a vaccine. Because we're all working towards a vaccine. We have 8 promising candidates. But this is nothing for today and tomorrow. This is for after tomorrow. This is for end of next year. So in the meantime, we need to learn to live with this virus, do our everyday business with this virus in mind, meaning protecting myself, but protecting others from myself. And these two things are of high importance. Don't only think about yourself and think, I'm fine, I'm young, I'm healthy. No, first of all, also young and healthy people get sick, but it's also you might be infecting others. So if we keep this in mind, we are out for a positive marathon rather than a negative one.
Okay. The World Health Organization is saying that there's already a playbook that works well for us in terms of stopping the virus, but not everyone is using it. What is in this playbook? Is it what you just talked about? Good hygiene and tracing?
The individual playbook contains, of course, the hygiene, mouth and hand, and the sneezing etiquette, for example, and coughing etiquette, and stay home when you feel sick. But of course, the other part is this tracing. And many countries feel that they don't have the capacity, or it's too expensive to do extensive tracing. It involves too many people. But just counter that with the costs of not doing it. The costs are lives. The cost is a cut on the economy. It's impacting on people's travel options. It's impacting on the kids in school. So these are way higher costs than what you would have to do if you need even half of an army of contact tracers. And it doesn't have to be all medical staff. It could be people trained just for that, for doing contact tracing. So if we do this vigorously, we are much better off, but we need to do it.
COVID-19 has a presence in over 200 countries and territories around the world. In terms of regions or countries, what's alarming for you? Where do you see the biggest problems right now?
So you mentioned, of course, the 10 million total cases and the 500,000 deaths so far. The Americas as a whole are unfortunately accounting for right exactly half of that. So North and South America, with the positive exception of Canada, who's really doing great, are a hotspot still and right now. And that is something we have to all work towards, because again, nobody's safe until we're all safe. India is a hotspot, and of course we always have to look out for more cases to come, possibly in Africa. That's what we're all worried about, to have this outbreak taking up larger proportions in countries who are less prepared for it. Many countries in North and South America have a great healthcare system, so the healthcare system as such is able to cope with it, but it needs to reach everyone. And we have seen every time and again that if you have a polarized and a politicized scenario around COVID-19, then the population is not convinced of the measures because they're torn between different messages and different rivalries giving these messages, then everybody's confused and doesn't know what to do. So this needs to be a solid, unified messaging. It needs unity on a national level and solidarity on an international level.
You said until a vaccine is found, is available for the world's entire population, we need to be following certain rules or guidelines from this playbook. I mean, as the leading international body that is overseeing this, what is your role, perhaps maybe talking about maybe with the private sector, because you talked about sort of governments and how they are dealing with this. How about private corporations?
So developing treatment or diagnostics or vaccine involves literally everybody in the world, meaning the private sector, the companies, the researchers, the scientists, and of course states or multilaterals as donors, and other corporations for the necessary financing. Yes, we do have more than 150, I think, candidate vaccines listed. And at least 8 of them are in the next stages. That means coming towards human trials, which is, of course, an important step to see how a vaccine works with a human. Does it protect everyone? Does it only protect a certain age group? Does it protect everybody also with underlying conditions? Does it work well? And does it not create any more harm than it does good? Of course, studies have to be done beforehand also on animals, but also on an ethical level. So everybody's involved in this, and we have seen a couple of countries and a couple of organizations come forward and be very generous in donations, because everybody realizes now that only working together this works. Because let's just imagine one country would be free of it, but free of corona, and other countries around not. That is just not possible. It's not working. So we're all in this, and we all need to work together.
Christian Lindmeier, pleasure to talk to you. We may be at this grim milestone, all of us, but because of the great work that the World Health Organization is doing, perhaps this number could have been much higher. Thank you very much for joining us here on TRT World.